Hello. So I'm here to answer your questions about the Areola prosthetics. I have had lots and lots of interest, which is amazing. So thank you very much. And also the interesting thing is the interest has been worldwide. So this just shows that there is a potential big area that we need to address and look at. This is the area post-surgery for breast cancer patients, gender affirming people, so someone has or any form of cosmetic surgery. If somebody has lost their areola and they have gone through surgery and they basically don't have a nipple anymore or an areola anymore, then the options currently are to have surgical nipple made, which is obviously the surgical area where they make a bump, and then obviously it still has no colour in it, so then what we do as tattooists, we tattoo the area. Or the other option is to have a 3D tattoo, which obviously I do and I love doing, and they are absolutely stunning and amazing. However, there is a period of time, so this is one of the questions, there is a period of time when somebody has their surgery to when they can have a tattoo. So that period of time, in my books, it's anything from 6 to 12 months. So what you will need to do as a patient is to wait 6 to 12 months post-surgery to make sure that the skin is back to its full strength, to make sure the scars have fully softened and healed. Bear in mind, scars can take up to 2 years and more to properly heal. So what we need to make sure is that when we're doing tattooing, that we make sure that the skin has got its full integrity and it's okay, so the canvas is perfect for the tattoo. When it comes to the gap between the time that you've had your surgery and then you have your tattoo, this is where prosthetics can come in. So an areola prosthetic is a silicone based, it's non-toxic, it is skin safe, non-toxic product. It will be adhered to the skin using adhesives. Now, when it comes to the adhesives, there are lots. So on my training course, I go through lots of different ones. Some of them will last 24 hours, some of them will last 5 to 7 days, and there are ones that can last up to a month. What you need to bear in mind with that is obviously the skin underneath where it's been adhered to. And we need to make sure that with bacteria and cleanliness that we only really recommend that someone keeps it on for about 5 days. So they are stuck onto the skin. So this is one of the questions I have actually, is how long can she leave it on the skin for, or he or she leave it on the skin for how many days at a time? That is the answer. So the answer, in my personal opinion, and it's more because of the skin underneath the prosthetic that you need to keep healthy, I would say to change it once a week or every 5 days. Once you've adhered it to the skin, it is waterproof. So the adhesives are waterproof, so you can shower, you can bathe, you can swim. You may need to tweak it slightly. So this is where when I'm talking to you, I'm talking to the person that might be wearing it. You may need to use your adhesive and really tweak it a little bit. So if an edge is coming away, then you can fix it. But realistically, it'll be absolutely fine and it will not move, because I have spoken to so many patients over the years where they have gone online because they don't have any options and the surgeons maybe not have given them any options. So what they've done is they've gone online, they've ordered some prosthetics from, I don't know, some big like Amazon or something like that. And they wasn't aware that they had to glue them to the skin. And I've heard some stories where they have found them random places on their body, not where they're supposed to be. So do be aware these are adhesive to the skin, adhered to the skin. So what you will need to do is, if I'm talking to you as a person that is interested in the training, then bear in mind that we will go through the glues, and it's down to you and to your clients what they select. It's not down to us to push our adhesive on the client. I think it's best to give them options and then they can choose which one works for them. So that's the timing, that's how long it will last on the skin for. And then when they take them off, what we recommend is they do like a treatment, like you'd have a facial. It's a really nice thing to recommend that they go through a process of treating the skin to a little bit of a nice treatment. So we use Ziggy cream here. So the Ziggy cream it's such a beautiful, safe, all natural product. We would recommend that they take the prosthetic off with the correct solvent. So there are solvent like removers to take them off. Once they've taken the prosthetic off, they can then obviously clean it, moisturize it, and I would probably say leave it off for 48 hours if they can. But we do recommend that the area is treated like with respect, because obviously you're going to want to put another prosthetic on top. So the other question we have, so what I'll do is I'll keep going through the questions, and then as my brain goes like it does, I will add more to the answers as I always go through. So is it reusable? Yes, the answer is yes. So as a professional that's going to be making these prosthetics, what you would want to give your clients, personally, I would say you don't want to give them one. So you're not, if they make an order, you're not going to send out one for them. I would recommend you send out 2 to 3 for a unilateral single side breast. If you are doing a bilateral, then obviously send out more, because what you want to do, especially in the early days of doing something, you want to perfect your craft, you want to get recommendations, and you want to make sure that the product is perfect for your client. So what we would recommend you do is when you're making them, you'll be making extras, and then obviously the client will have spares. However, they are reusable. So the edges are going to be as thin as we can possibly make them. However, if they are too thin, they potentially can tear, hence why we will send out spares. The moulds that we make and the moulds that we can cast. So this is another question. This is me going off on a tangent. If you are ordering as a patient, if you are ordering a set, like a left and a right, you potentially can reuse those ones, and you can have a stock of different ones. So you might want to order a different colour for one day, and then next time round you might go, do you know what, I would like them a little bit darker, so I'll order another set. They are reusable, so once you've pulled them off of the skin, once you've taken them off really cleanly, you will just give them a wash, and then they can basically be reapplied to the skin, which is perfect. So they can be used for special occasions, they can be used for daily use, so it's up to the person how they want to use them. But yes, the answer is they are reusable. The silicone is long wearing, and it should be long lasting. However, wear and tear and care can potentially change the life of the prosthetic. So what you want to make sure that you're saying to your patients, or if I'm talking to you now as a client, then you will need to be aware that potentially they won't last forever if you're going to be putting them on every day. But if you are ordering them for a special occasion and you are wanting to wear them, to trial them, even if it's just the run up to your tattoo day, then you can reuse it as often as you want to. So the other question I have, which is not on here, is about, I don't know if I mentioned about, I think I did, they are waterproof. So the other question I had about the actual prosthetics is, could it cause an allergic reaction? Is there any side effects? The only side effects that there would be from this is the adhesive, if somebody is allergic. So you're welcome to check with the person that's wearing it to make sure that they're okay with that type of adhesive. But there are different ones available, so don't write it off if it's not suitable for you. Then you might be okay with a different adhesive. The other thing about the actual physical product itself, it is non-toxic and it is skin safe, so it's perfect. How many months after surgery can they be used? Personally, if you, depending on the surgery type that the person has, if you have an implant and your scar is not on the area at all, then I would possibly say you could at least wait. If there's no scar through the area, then in theory you could use them straight away, because all you're doing is sticking an adhesive on. What you will want to do is probably use one of the weaker adhesives and actually use ones that only last for like 24 hours and just trial it and see. If you have a scar going through the area that you want to make the placement on, then I would at least wait 2 to 3 months post-surgery before you start using these. But everybody heals at different rates. What you do not want to do is aggravate the scar in any way whatsoever. So do not apply these to a fresh scar. This is not suitable for straight out of surgery, but it is an option after surgery before a tattoo. The other option this is for potentially somebody that has got a tattoo already and they would like something more 3D. So if you have a tattoo and you are a patient of mine, and you've had it, or anyone, and you've had a 3D tattoo already done for you, then how amazing would it be is if you wanted to have a little bit more 3D for a special occasion. Say you are a BRCA patient, and the BRCA patients are the people that carry the gene mutation. So our BRCA, and there's other gene types as well. If you are a gene person and you are very young, and I'm not saying this because of ageism, I think if you're old, you could still do this. Like, I'm old and I would still do this too. If you have elected to have a mastectomy and you haven't got any nipples and you've had the double mastectomy, and you are a young person and you are going on the girls' holidays and you are wanting to wear little dresses and things like that, then a tattoo is a tattoo, but it'll always be flat. This is where a prosthetic will look and feel a little bit more realistic and lifelike for you. So obviously dating, things like that, it does help. This is a complimentary service, and this is what I want to get across to people. This is a complimentary service. It's not replacing tattoos in any way, because I'd be doing myself out of business. I work a lot on tattooing. The majority of my work is boobs and brows. I will be doing something for people that help them, and that is where this has come across. This became a thing because of doing my pre-draw with my patients. When I'm in the room with them and when I'm teaching, I'm trying to make the process really easy for them. And if they can visualize something when they're in the room, then for me that was even better. But also, if you can, as a student and you're learning, if you're struggling with placement, then your client, number one, could have some prosthetics before they come to you. They can get used to placement and they can get used to where they like to wear them. And then obviously once they're here, it's so much easier. Bear in mind, you're tattooing on their body. If they're in the room with you and they haven't prepared anything or placement or anything like that, then it gives you an idea of where you can place them, and then they can have a look in the mirror and they can see a finished result. When we're doing tattooing, we tattoo or we template an around the outside marker point, and it's really hard for some people to visualize where it's actually going to be put. So this is what you've got to understand. For a client that can't visualize what we visualize as an artist, it's really helpful if you had some prosthetics in your room that you could put on the skin. You could just put a bit of Vaseline on the back of them and put them on, and then go into the mirror and say, would you like to have a little play around with placement? Obviously, asymmetry and different surgeries on both sides. I have been treating hundreds and hundreds of patients over the years, and it's very rare that somebody comes in with a perfectly symmetrical reconstruction. So this is where these tools will come in to help for you as a tattoo artist. So if you're thinking about it, learning how to make them, then this is perfect for you. If you want to make them to actually retail them, to sell them, to offer them to clients. If you are a patient and you want to trial them out before you have your tattoo, and obviously after you've even had your tattoo, you can stick them on top of the tattoo. So if you're going out and you're wearing a little dress, or you feel that you want to have something more 3D for an occasion, then you can use your tattoos as guides and you can stick them on top. I just think that it's a really, really good option for people. And for me, I would like, and I think this is where tattooing is coming in as well, there are lots and lots of people doing tattoos now. There are lots and lots of them, but I still get people coming to me that didn't even know it was a thing. They say, you're one of the only people in the UK doing it, and they're like, I'm like, no, there's not, there's hundreds of us. So, but the thing is as well, is what you've got to remember when a patient goes into a room with a surgeon, this is where we need the surgeon and the breast care nurses and all the nurses in the hospitals and any unit that's dealing with like the photography to do with the breast unit, or any gender affirming surgeons or specialists. This is where they need to be given the options. So what options are there available for me post-surgery? So the options are, you can have a nipple made for you. There's no colour in it, so you have to have a tattoo. That's fine. If you haven't had a nipple made, then obviously a prosthetic is an option as well. So it's knowing what options are available for different people. Not everybody wants a tattoo. And also you have to appreciate, as a tattooist, not every skin accepts a tattoo in the way that another person's skin does. So there are always cases where the ink breaks down more. What if you were carrying over the top of somebody's tattoo and they created a lot of scar tissue and it just doesn't heal as good? So all I'm doing with the prosthetics for the UK and trying to put it out there is to give people another option following surgery. So I have more questions because I've gone off on a tangent, and I can always do anyway. So This lady sent me loads of questions over, so it's really good. I think that was actually it for that one. Let me go to my other place. I think there was some more questions. So I'm going to pause this and I'm going to come back in 2 seconds because I know there's more questions and I just want to refresh what I've just said. Okay, so I've just looked at my questions and I don't really have any more to answer right now. I will do a version 2 because I'm sure after I've talked about this today, then I'm sure other people will have different questions. If you are interested in doing the training, there is a discount on the training for, I think it was 72 hours when I launched it, so I'll double check on the time, but obviously the time this goes out, I'll just make sure that it's still valid. If you are interested in doing the training course, you do not, number one, you do not need to be a permanent makeup artist, you do not need to be a beautician, you do not need to be anything. You can be anybody that wants to help with the post-breast cancer, post-breast surgery, post-top surgery treatments. You can do this, anybody can do this. This is a vocational skill, it's a treatment skill that you're learning, and you're learning step by step how to make the prosthetics for your patients. The training is under the word on point, because that is the point, and the on point training is available via my website, which is thepmuschool.co.uk, because it is a training school and that's what we're here to teach. So I hope I've covered the answers for who is your client base, who could potentially wear them, how long can you wear them, are they waterproof, are they glued on, and also the other questions with regards to the safety side of it. Is it toxic? Is it not toxic? Is it allergic? So I'm open to answering any questions about the treatments and also sending out the prosthetics. So before I go, because I've just had a brain about a question about something. So if you are a patient and you're looking at having this treatment done, and you would like to order some prosthetics, then there are a couple of options available for you. So this is where I wanted to make it available for everybody. If you are in the UK and you live close to me and you live here and you have a single side and you would like to get a prosthetic for the other side, then what we can do is we can make a mold of your existing side, and then what we can do is recreate that mold and give you exactly the same on the other side, which is beautiful. So it means we can colour it to the same colour, and we can obviously make a mould, so shape, size and everything will be exactly the same as the other side. If you are just about to have surgery and you are going to potentially come out the other side with your areolas, then you can still take a mould of your areola nipples before you go through the surgery. The reason I'm saying that is because sometimes the surgeries mean that you will come out the other side without them because some things happened, they've looked at margins and things like that. So if you are going in for surgery and potentially you would like to get a mould made before removal, then you can do that too, and you can have your moulds made. Then again, we can make prosthetics of your exact mould before you've had your surgery. If you are living anywhere in the world and you would like to order your prosthetics, then what we would like to say to you, there's going to be a database basically of prosthetics that you can choose from, so you can order. If you are a single side and you would like to order one for the other side, then obviously what you're going to have to do is match as much as possible. There's going to be shapes and sizes and colours. If you have a special requirement, we can try and adapt it and make it to suit. If you take photos, we can try and mould it. So there are options for you. If you are a double and you live anywhere in the world and you'd like to order a set, then obviously again, you can order whatever ones you would like, size, shape, colour. So that is the answer that I wanted to just to quickly talk about, was the moulding side of it and actually the potential that this has. So for any nurses and surgeons and breast care people and anybody that's talking to anybody at the moment that may be going through the treatments or the surgeries and the aftercare, then please, and if you work at a hospital or a clinic and you're interested in having a talk about this and finding out more details, then do get in touch. The website for the prosthetics, which it's available for training right now, but it's not available to launch yet for the products, is www.nippleprosthetics.co.uk. You can go on there if you are a hospital, a clinic or a centre. You can go on there and you can request to be added to the mailing list for details, and then as soon as we're ready we'll send you out packs so that then you can give them to your patients and give them the options. So the more people that do this training, the more availability there will be worldwide, the more people will be able to make these for our patients. And also, obviously, if you are a tattooist and you are doing areola tattooing, then it's a really, really good tool to have in your treatment just for doing your tattooing, because they are realistic. You can copy it and also you can use it for your pre-draw. So I hope that has answered all of your questions. I will post this on Instagram. I think it might be too long to post on Instagram, so what I will do is I'll post a little snip on Instagram and then I'll upload this to YouTube, and then you guys can watch it as much as you want to. What I will do is, once I've uploaded it to YouTube, is I will wait to see if there's any comments underneath. And if there are comments underneath, then please feel free to ask a question about it. It is a new service. It is a brand new service that we're offering. And it is available to be, well, the training's available to do now. So you're welcome to do the training. If you are a patient and you're wanting to talk to me about having your molds made or having an order, then please, again, comment underneath or get in touch with me via Instagram. But I hope that's answered any questions for you. And like I said, this is just the beginning, so we will be adding on answers to your questions. Take care.